From MTN, the Montana Television Network, this is Face the State.
Good morning and welcome to Face the State here on the Montana Television Network. Jay Kohn here with you this morning, and we're going to get your week off to a good start talking a little bit about health care. And let's introduce you to our guests in the studio with us this morning. Next to me we have Dr. Randall Gibb. Dr. Gibb is the Chief Executive Officer of Billings Clinic. And next we have Jim Duncan, the President of the Billings Clinic Foundation. Both of you gentlemen, nice enough to join us on short notice to talk about health care. Thanks so much for joining us.
Glad to be here.
Dr. Gibb is the new Chief Executive Officer of Billings Clinic. You've been with the clinic for 11 years. You were the interim CEO, replacing longtime CEO Dr. Nick Wolter. And now just within the last few months, or last few weeks rather, they took the interim title away. So you're officially the CEO. Tell us a little bit about how you got to Billings, Dr. Gibb.
Yeah, it's a very good story. I've been with the Billings Clinic for 11 years. I came initially as the first gynecologic oncologist. So that's a surgical oncologist who takes care of women's cancers. And came specifically because we were developing our cancer center at that time, and I was to be the first in a 5-state area. So I came from academic medicine from Washington University to really start taking care of the women in this region for that specific reason.
So you've been on the job training for the last several months. They did a nationwide search, but they decided you're the man. So that's got to be a nice pat on the back. And
I'm very honored, obviously privileged. It's a great place to work, Billings Clinic, and it certainly represents one of the pinnacle healthcare systems in the Northwest, and it truly is an honor to serve in this purpose.
Jim Duncan, let's bring you into the discussion. You've been president of the Billings Clinic Foundation. You were telling me for 23 years now. Congratulations.
Well, thank you. It's been a great organization to work for, and I've loved being part of this community. And it's been awesome to see the clinic grow over those years, and it has really changed. And I joined shortly after the integration of Billings Clinic with Deaconess Medical Center, and our foundation's been part of that all throughout that integration and then after in the years following.
So tell our viewers a little bit about the foundation, because every great organization these days better have a foundation to endow it into the future, and certainly that model is working well here. How do the two work together kind of hand in glove?
Well, when I started, we had just about $3.5–4 million in assets at the foundation, and today we're now up over $70 million in assets, but more importantly, we have been able to give back to Billings Clinic over this time about $85 million. And we just met with our auditors yesterday, and our numbers for the fiscal year that just ended June 30th of this year, we were able to give back $8.7 million. So it really provides Billings Clinic with what we call the margin of excellence. And a lot of the things you see at our organization were made possible thanks to the generosity of donors. Philanthropy plays a key role. When you get $1 million gift, it takes Billings Clinic about $33 million in revenue to equal that. So you can see how an investment of a charitable gift really does allow us to advance technology programs, build new projects, and so forth. So over that time, we are a separate organization, the foundation. We have our own board, but we're very tied to Billings Clinic. It's a hand-in-glove relationship. We want to be there to support the needs of the clinic, work together. We have a lot of cross-referencing between our two organizations on our boards and our accounting processes. And so I'm very proud of how the clinic helps set the direction, and we help find people to help us advance the mission.
Billings Clinic, for our viewers this morning, is the largest healthcare organization, health system in Montana. It's a physician-led, multi-specialty group practice, 304-bed hospital, level 2 trauma center, 4,200 employees. You say the biggest employer in the state, Jim?
I think it's the largest private employer.
Okay.
And that fluctuates a little bit here and there, but certainly in Yellowstone County, we are for sure.
And Dr. Gibb, it says 450 physicians and advanced practitioners offering more than 50 specialties. So good luck directing that. And,
Thank you.
It must be. So give me just a slice of your job on any given day.
Yeah, it's actually a tremendous job. I'm a surgeon by trade, so I get up pretty early. That's sort of where I get my private work done and get my emails all taken care of in the morning. And then it really can be a lot of meetings throughout the day. But what I want to just say is I think what's changing about healthcare, and we could get into it, is this team-based approach. And one of the things that I've tried to do, and I think even with the senior team we've tried to do, is a part of the CEO's job is getting out and about in front of the organization, being able to see what's going on at the front lines, getting outside of the office per se, and what you would routinely think is meetings after meetings, and really trying to learn from our providers, our nurses, our staff, who are all excellent. What are their needs so that we can continue to take great care of our patients? And so that's one of the things that I really like in this job, is because it gives me the opportunity to get out and about amongst the organization.
In some respects, you're the face of Billings Clinic, but I mean, when you look at all the faces, I'm thinking of the ads you guys run with all the, I mean, you're just one face, but you're definitely the ambassador that is the front line for the clinic.
Yeah, and you know, it really is our staff, our providers, and our nurses who are the face every day with the patient. Cannot stress enough the importance of them and their interactions with the patient to make that patient experience the best it can be, while at the same time delivering the highest quality care.
One of the things that is stressed in reading about the clinic is it said one of the cornerstone principles requires the CEO to be a physician. I'm going to ask you to comment on that. You just kind of explained why you kind of have to have your fingers in everything and your eyes glancing on all aspects of the operation.
Yeah, I think it's very important to understand that that probably is the one of the strongest cornerstone principles, is that we have physician leadership. And what's important there is it's not just physician leadership at the CEO level. So there are physicians at leadership levels throughout our organization. Physicians serve on the board. They serve on an internal board called Leadership Council, which really directs all of the activities and operations of Billings Clinic. And then we have physician leaders on the senior executive team, and also leading the effort at department chair and medical director levels. All of those levels within the organization have physician involvement. What I like about having physicians in those places is not that they are necessarily the greatest business acumen, although I'll be honest with you, as you progress, you get very good at that. But what I like is the physician brings the patient perspective to the equation. And so I'm always comforted, sometimes amazed, when we get into a difficult discussion about what we ought to do or where we ought to put our resources. We always come back and focus what's best for the patient. And that patient-centric care really is driven from the physician perspective. And that's what makes it special.
And as a non-clinical person, over the years, as I've sat at tables where we're making big decisions or addressing tough challenges, that conversation is entirely different when you're in a room that's got a number of physicians, nurses. People think that maybe the bottom line is the most important thing. The quality care, patient-centered care, as Dr. Gibb mentioned, is really where that focus always turns back to. Let's do what's right for the patient. And then we'll figure out how we're going to pay for it or make it happen.
Figuring out how to pay for it is key. As I was looking to come up with some good questions for the show, why is healthcare in the United States so expensive? It says U.S. is about twice as much the cost here of any other developed country. And so just a kind of a ballpark, why is it so expensive?
Yeah, I mean, that's a very, very complex answer. We'd probably take all day to figure that out.
Okay, let's skip on.
But no, but the thing is healthcare is very expensive because right now it's probably not being delivered as efficiently as it can be. And I think one of the goals of healthcare and some of the changes that you're seeing with the ACA is how do we work together with other companies, payers, and the government to more efficiently deliver that high quality care, cut out the waste. And by doing so, we will be able to ratchet down the costs. But it really is focusing on that efficient, high quality care delivery model that yet has been elusive. We're working on it. That'll get us there.
Also in America, I think when you're really sick, this is the place to be. Yeah. And people all over the world kind of know that the really high-end kinds of medical services happen here and happen really well here. We've got to do better at general day-to-day population health, as you mentioned. And so you couldn't create a more complicated payment system than what we have.
If you tried.
If you tried. But I think we're all trying to figure out how we can do it more efficiently. However, we have an aging population. The baby boomers are seeking health care more and more. There's a huge demand. There's a shortage of workforce in physicians and nurses in a lot of different areas. Technology keeps improving and it's expensive. And there's the pharmaceutical costs. All of those things make for a very good scenario to get really good care when you're really sick, but it's really expensive, and there's a lot of demand for it. We're full, we're busy. We have lots of demands on our system that we're struggling to keep pace with, just space-wise and staff-wise and all that, because of this growing need.
Let's talk a little bit about the footprint of the clinic, because obviously we're here in Billings and you're one of the biggest players here and the biggest player in the state. But as I look, I mean, we're talking, you've got affiliations with other hospitals and clinics around the state: Red Lodge, Lewistown, Colstrip, Scobie, Glendive, Livingston, Lovell, Wyoming, Big Timber, Roundup, Plentywood, Columbus. I mean, the list goes on and on. That is an expanding footprint. Tell us about that. Has to be a challenge all on its own.
You know, it is, but it's also a blessing. I mean, we consider these very strong partnerships. We're able to work with these critical access hospital partners and really work together to deliver high quality care into that region, but also allow them to have some of that buffering that they want, given all the constraints that they have as a smaller hospital system. And so we really value those partnerships. They serve, we feel like we serve their populations well, and we really make sure that we are providing the same level of care. Our goal with those regional sites is, can we keep as much quality care as possible in the local community? And then only when they need that high-level tertiary care do they get to Billings. And we've been quite successful at that, and that certainly that's one of the reasons why you see us have so many local partnerships.
Well, and over half, or depends on the area, but a huge percentage of our admissions to Billings Clinic are from people that live outside of Yellowstone County. So we have an interdependent relationship between these organizations, and so working together, they can have a common medical record so that when they're here for a couple days, they can go back home, and it's a more seamless transition between the two. And we live in a rural state, and people come to see the physicians and specialists at the clinic from hundreds of miles away. And so that partnership in all those communities has really been beneficial, I think, as we grow. And we need each other to be successful. We need to work closely with them, and they need our relationship to help them sustain what they want to do in their communities.
Yeah, and I'll just add one thing to what Jim said. I like how you said how we're interdependent. But the other thing that's really absolutely phenomenal about the clinic is we actually travel to those sites and we provide outreach where we send physicians to those locations. So there's many times the specialist actually goes to that community hospital or rural hospital and provides that service. They're, not having to have the patient travel. And when you look at that, we provide about 100 of those clinics a month where our specialists are out into the rural area. And that's been a very big positive as well.
I can imagine. Jim, when it comes to philanthropy and getting people to contribute, people love giving to their local hospital, but how's that affected how the clinic approaches that? Because someone that might want to donate to the Wheatland Memorial Healthcare may be a little reticent. I don't want it to go to the clinic, but I want my money to be spent here. Do you run into that, or how does that?
We've had a really good working relationship. Some donors give to Mayo Clinic that live here, and we respect that. So it's really up to the donor. We're trying to work together, and a lot of times with philanthropy, if we can talk to a donor who can make something possible in the tertiary center like at Billings Clinic, but also support the critical access hospital in their own area, we just have to work on that as a system and as a team, and that's where our focus is. It's not a competition. We raise money at our foundation that helps support rural activities. So we're trying to, we're all part of the same goal, and so there's really not been a lot of friction there. There could be, I'm sure. I'd love to have all the people who give to the national organizations. We are trying to make a case for why an investment in our organization is a good investment. We'll be good stewards of it, and we're trying to convince people that we're worthy of philanthropy, not just needy.
If you're just joining us here on Face the State this morning, we're talking about health care with two of the top officials with the Billings Clinic. Next to me, we have Chief Executive Officer Dr. Randall Gibb joining us. He was just appointed as the CEO after being the interim CEO for almost a year. And then we have Jim Duncan, president of the Billings Clinic Foundation, and we're getting some insight into the changing world of healthcare. And we were talking before we started to tape this morning. I was saying how much different it is when you go to see the doctor today versus like when I was growing up. And I asked, do doctors still make house calls? And you said, sometimes, but sometimes it's the specialists under the doctor that will perhaps make a house call these days.
Yeah, and you know what has definitely changed from 15 to 20 years ago, it used to be the doctor and the patient were pretty much the only two that were involved in that healthcare relationship.
Right.
And you might have seen a nurse. But nowadays, what we do is we have complex care teams. We have to have team members that represent many areas of specialization. That's going to include physicians, that's going to include nurses, that's going to include care coordinators, social workers, pharmacists, and other therapists. And so when you brought that up, in my mind, the reality of a doctor actually going out to the house, it actually does happen. And it's actually happening a little bit more as we look at population health. But where you're really seeing the growth of that endeavor is where you have these other team members supporting and helping the patient in their care with the physician's guidance by a therapist in the house. And again, that just brings down the cost of that care, makes it more efficient for the patient because it's provided in the house.
Plus, through telemedicine, we have doctors in the smaller communities in the region. Who knows where that will go over the years, but there's a lot of technology that's emerging for that relationship change.
So tell me what your top priority is, and I wrote down a couple questions here. One was, what is your top priority, and what's the biggest challenge facing the clinic? Because they might be different.
Well, it actually is one and the same, because as we've discussed this morning, healthcare right now and the delivery of healthcare is increasingly becoming more complex. And so one of the biggest things that I think I can do as the Chief Executive Officer is really lay the foundation for what our expectations are for developing that great team. We have to, I tell physicians all the time, you at times have to be a quarterback, a team quarterback, but at the same time you have to be a very good team member. And so when you look at how we deliver care, especially when it's to the population, especially when we're looking at ways to prevent the patient from actually having to come into the hospital. So really managing that disease state and outside in the clinic, it really is about developing those teams. So my message every day is, how are we doing on teamwork? Who do we need on the team? What are some of the barriers that we need to overcome by involving another person or another entity within the organization to make sure that that team is functioning as highly as possible, with the sole focus that that team has to take care of that patient and make sure their care is high quality.
And Jim, how about you at the foundation? What's the biggest challenge for you these days, and perhaps what's your top priority?
Well, I think the biggest challenge is the uncertainty of what's happening with healthcare financing and reimbursement at the national level. You know, and in multiple sessions, we don't know what to expect a month from now, a year from now, 5 years from now, certainly. And so we know at the foundation that philanthropy is going to play an increasingly important role to be that stability for these uncertain times if reimbursement changes drastically. And so that's where we try to help add those elements. And so I think there's just a lot of great causes in our community and our state, and so trying to make sure that people who want to see this great organization continue to grow and thrive and add new specialties, and finding those dollars and convincing people that this is a really good investment and you'll help save lives and help advance our community. That's what we're after, is just trying to grow that and continue to foster success.
I should have asked you, give me a slice of your typical day in Jim Duncan's life, because I know already this morning you were on the radio to talk about a new preschool tax that Montana has, and I know probably your top priority right now is the Clinic Classic that's coming up, and that's one of the big fundraisers, the biggest the clinic does all year long. So you kind of have to wear multiple hats on any given day.
I do. I really enjoy the fact that I have a lot of opportunities. I work in our community relations department, and that that is a really diverse day of opportunities. You never know what's going to hit. I mean, we're a small city up there in our downtown campus, but if you think about all our branch clinics, in addition to those that you mentioned that we have relationships with, and so the days are interesting, and you're never quite certain what you're coming into. But the Classic is coming up, and we like to showcase the Billings Clinic, and we move it around. You know, one year it's diabetes, cancer, pediatrics. Right. This year is really kind of a different focus for us. We're focusing on our Friends of Nursing program. Nursing is at the core of who we are. Certainly we're a physician-led organization, we're community governed, we've got a great team, but our Friends of Nursing program is a scholarship program within our organization that benefits all our nurses plus all our non-physician and non-leadership staff to get them the training they need to continue to be on the leading edge of their profession, whether they're a respiratory therapist, an occupational therapist, a nurse, someone working to provide that care at the bedside. And the learning curve is steep. Medical knowledge doubles more frequently now than it has in history. And so an investment in the education of this team that's the core of Billings Clinic is something we're very proud of. So that's our cause this year. We're excited about it. The Classic has had years and years and years of great success. Right. And it gives us a chance to tell our story, and I think people really do like to hear what we're doing and how we've succeeded.
And it's a great outreach to the community because you bring in a good act. We have lots of golf tournaments, but you get to rub elbows with the very people that you serve and who are involved in this endeavor. And it's kind of outside of the typical environment there.
Right. And it's really fun because in addition to the golf and all that, it highlights being in the center of our community, downtown Billings, with this great event where we partner with the Alberta Bear Theater and the neighbors around there. It's a great thing, and that's one of the things I love about the clinic is our board, our people that live here, they make the decisions about what's best for our organization and our community. So the more we can stay connected to the needs of our community and our region is really important. And I think that's been a core piece of Billings Clinic. And when we are successful and we invest in building new facilities, we always use local contractors and designers, and we try to infuse everything we can to help the economy of Billings Clinic grow, as we're one of the largest pieces of that economy. And so it's been a real great opportunity to be part of that.
You probably couldn't come up with a more divisive issue than the politics surrounding American healthcare right now. It's on the front page of the papers every night. I mean, the recent debate in the Senate, and we're kind of right back where we started from. I don't want you to talk politics, but your perspective, because you guys are on the receiving end of whatever they decide in Washington, and then you're still trying to provide this quality care in a very uncertain environment.
Yeah, you hit it on the head. You know, for us right now, the ACA was a first step towards an understanding of how we could deliver healthcare better to our population across the United States. And certainly there's components of Medicare and Medicaid in that which are very important, both at the federal and the state level. All of us understand that that was a first pass. And what we really, you know, as healthcare providers, as we go through this exercise, we realize that there are some things that are very good about that bill and some things that we would like to change for the better. And what we ask, and you know, as we go through this process, is that people really look at an opportunity to get together and dialogue, because there really are some things that we can do better that will strengthen the healthcare delivery model in the United States.
It seemed like some of the approach was to throw the baby out with the bathwater, not to overuse that cliche, but you know, Rome wasn't built in a day, and this healthcare system is a work in progress.
Right.
Well, we mentioned earlier, you know, you couldn't have dreamed up a more complicated system for healthcare reimbursement.
How did we get here?
but I think what we're focused on every day is we know healthcare costs a lot of money for people, for businesses. It's the costs are rising too fast. So the focus on being efficient, being good stewards, trying to do things better, and find the right way to lower cost and still meet people's demands. When they get sick, they want great specialists to be at the Billings Clinic. They want a great primary care doc. They want a great nurse and a great facility. So you've kind of got all these things coming at you, but the uncertainty is what's challenging, and really not knowing what to expect month to month, year to year, as I mentioned earlier.
Right.
So we hear what people are asking, and that is try to reduce the cost of health care. And we're working on that at every meeting we go to. What's the value equation of health care, and how can we, Billings Clinic, help be a partner in that?
You're talking about the economy and the number of jobs that is involved in the whole clinic operation. I've seen these projections that you're going to need 1,000 new employees over the next 10 years or something. Maybe that's just a ballpark figure, but where do you find all these employees? And for people watching, there's all these opportunities in healthcare. It must be a great field to be getting into right now.
Yeah, certainly healthcare is going to be one of these things. Jim mentioned earlier, our population's aging in the state of Montana. It's aging in the United States, and so the need exists for us to develop healthcare related jobs and occupations just to cover the demand that we're going to have. We have demands in nursing, we have demands in in the physician side, and then any and all staff at all levels. So, you know, from our perspective, as Jim mentions, the community effort by which we have some community partners who want to work with us to drive education of these health-related specialties, like Rocky Mountain College and Montana State University Billings.
Right.
What are some opportunities that we can have to really dedicate educational efforts to bring in those highly qualified people to do healthcare?
And that's where you've seen us grow our own programs, like adding our internal medicine residency program was a big step, because people still have problem finding a doctor.
Right.
The primary care access is challenging for our state. Many communities don't have physicians. So our goal, working on our residency program and with the Montana Family Medicine residency program that we're partners with St. V's and Riverstone on, is if we can train more docs here, chances of them staying here are higher. 60 to 70% will stay here. So that's why you've seen us take this step into more of this training and academic medical center type model. And so we hope to do more of that, because we know there's a shortage, and again, the aging population and the need will be there.
I told you guys this was going to fly right by this morning. So finally, just put the crystal ball on the desk and tell me what you see 10 years from now. What's the healthcare of the future look like?
Well, I'm an eternal optimist. I love healthcare, because one of the greatest things about healthcare is it's constantly evolving, constantly changing, and we're constantly doing things better. So in the next 10 years, especially from the cancer perspective, I know we're going to make significant advances in the fight against cancer. And I know we're going to take better care of patients, and we're going to make them more comfortable, and we're going to keep them more healthy. And so that's the great thing about healthcare, is we continue to make advances every day. We're continuing to learn how to take better care of our patients. And so as an optimist, I'm excited, because it truly is a field.
You have me excited.
It is truly a field that you're going to continually learn in, but it's going to continually get our patients better.
Jim, how about your perspective?
Well, for me, I just like seeing Billings prosper. And I love this community, I love the state, and I want Billings Clinic and our organization to continue to be part of the exciting future that this community has, and that we're able to still meet the needs and keep growing and do it in a way that people see as progressive and moving, adding new specialties, all those things. That does, people who have parents that live in eastern Montana, makes you sleep at night easier if you know you can
Absolutely.
trust the organization that we have here. So that's my hope for the future.
Well, thank you both for sharing your perspective and your knowledge with us. Jim Duncan, president of the Billings Clinic Foundation, and Dr. Randall Gibb, chief executive officer from Billings Clinic, joining us here on Face the State. So I hope you learned something this morning. I know I did. Have a great week, and we'll talk to you again soon.
You've been watching Face the State, a presentation of MTN, the Montana Television Network.